diabetes. What are you going to be doing to protect yourself and push others into protecting you going forward? Whether it's your boss, are you going to tell them to take you off the front line a little bit more, protect you a little bit more? You're going to be a little bit more insistent on getting PPE, and how are we going to ensure that if there is a second wave, people from a South Asian background are better protected? This is because of a national report out today stating South Asians in hospital with COVID-19 are 19% more likely to die. Get in touch, let me know. I'm going to go to Ravi in a moment, but Lavina, morning. What do you think? I mean, you were listening to a little bit of that interview I carried out with Professor Semple as well. What's your point of view and your reaction to that?
I think I've been on a mission, I know, to try and raise awareness. So I think Asians are starting to listen, but I think there's so much more education and work that needs to be done. I would love there to be policy changes coming down from the government of giving advice of what people can actually do safely from home. Obviously, I'm a personal trainer and a wellness coach, and I'm promoting the benefits of exercise to actually help treat, reduce risk, and even prevent things like type 2 diabetes. So I think it's awareness, it's education. I'm so glad this report has come out, and I hope, programs like this and the press really pick up on it and get people aware.
And given the fact that we've heard this interview, that we've got this national report out now, how confident are you that South Asians are actually going to listen to the advice, do more?
I'm speaking as a British Asian, and with parents, I've got family members that have diabetes. It then makes us so much more susceptible. I mean, we have 6 times more likely chance anyway, pre-coronavirus, of having diabetes in the UK. I think we have a tendency, it's just a cultural thing, to not really listen and grasp the facts. And this was pre-coronavirus. I raised a big campaign to try and get UK Asians fit, and diabetes was one of those big triggers. I was just alarmed at the statistics. Now, having gone through this awful pandemic, I think finally our Asians will start realizing. And I do hope that, community groups, big communities need to start giving people information. And I'm all about providing free methods, things people can do to change their lifestyles, using exercise, using healthy eating. There's so much they can do for free from home safely.
Thank you, Lavina. Stay there. We're going to go to Rajveer in a moment. But Ravi, morning. What are your thoughts on the topic today? What's come out of this interview with the chief investigator of this study as well?
Hi, Kessa. Echoing almost everything that all the other people have said, Lavinia as well. I'm a group exercise instructor. And if I can add something which maybe other people haven't talked about, the World Health Organization classified obesity as a pandemic nearly 20 years ago. So I think it's worth considering that, and obesity is connected. I know it's been spoken about, but it's not the only thing. It's also worth pointing out that South Asians, and females in particular, are the most inactive group in the UK, significantly to other sort of ethnicities and demographics. And so, and to Lavinia's point as well, I think that the answer is found in reducing barriers and creating opportunities through coaching. A lot of that can be done through technology, using techniques like nudge coaching, and really reminding people who, by the way, it's not just South Asians, we're constantly bombarded with advertising about eat these sorts of junk foods and, watch these box sets or whatever it might be. It's an exhaustive list. That's not an exhaustive list. What we need more influencers. We need more people who take this seriously to influence the rest of the South Asian community. And your professor pointed this out. We need it to be done at a community level, not constantly from government, not constantly top down. So I think that, personally, I think the answer is found in fitness instructors and group exercise instructors.
Lavina, why don't you chat to Ravi here? I mean, you're both on a similar sort of line, aren't you?
Yes, I mean, this whole campaign that I raised, Ravi, you've just touched on it. So UK Asians are less likely to be physically active than the white population. We have a government guideline of what exercise you should be trying to hit for optimum health. And if you try and hit those stats, so it's basically 2.5 hours a week of aerobic exercise and 2 to 3 strength training workouts a week. If someone is able to do that, and I know that sounds a lot for people that don't exercise regularly, the figures on reducing your risk of things like type 2 diabetes can go up to 50%. It lowers your risk of diabetes, early death, coronary heart disease, stroke, dementia, cancer, osteoarthritis. I mean, the list goes on. So you have the power to actually take control. I would love the government to prescribe exercise like a drug. And I think it needs our community. So our big, like we've got loads of Asian communities, big groups that have done lockdown programs. I've been involved in so many. I've been running senior workouts where I'm getting 1,000 members for free per session on Zoom. I love seeing them. I'm trying to get people, even them, because they are the most vulnerable. They are elderly and their immune systems are even more susceptible to infection like coronavirus. But they can actually start doing things from home, not just to boost their physical health, but also to combat loneliness, to help with their mental health. So I think we're in an amazing position. I'm very all about what you've just said as well. Both of, that we're on the same page about getting the message across from people like ourselves. I think there is a lack of role models in the fitness industry in the Asian community, and there needs to be awareness. So I have things called exercise snacks, and that's something I've been on TV and radio about before coronavirus, where it's free, accessible, short bouts of exercise. So instead of trying to break, 30 minutes a day, you can just do 5 minutes, 10 minutes, it all counts.
Can I just come in here on both of you for a moment? With all due respect, it's not just about exercise, though, is it? No. That's something that Professor Callum Semple was very keen to stress. In fact, it was about only 20% of, diabetes, type 2 diabetes, lifestyle, underlying health conditions factored for a part of why South Asians are dying in hospital more from the coronavirus. But there was also a whole amount, about 80% of them, that they couldn't factor. They didn't know what it was. It could be socioeconomic reasons. It could be genetics. They simply had no idea. And that's why I also that's why I asked him, and I'm also asking the pair of you, given the fact that it's just simply unknown, we just don't know it, well, what do you think needs to be done then? I mean, do you think we need to be more careful about not going out? Do we need to protect ourselves more in case of a second wave? Do we need to pressure our bosses and those who we work for to actually keep us more safe? Or do we, as Professor Semple was also saying, need to put pressure on our MPs to actually make sure that it's in the policy that South Asians are protected more? There's also the vaccine issue as well. Should we be getting the vaccine first? What do you think? I'll come to Ravi on this first.
It's a broad and very big question, Kessa, and I think I'm not claiming, and I don't think Lavinia's claiming this either, that exercise is the answer. What I believe is it's the launch pad. It's the door. It's sort of, it gets people into the right mind or the right frame of mind to then start thinking, okay, well, I'm exercising more. Maybe I need to think a bit more about what I'm eating. Maybe I need to mix with people who motivate me to exercise, and maybe we'll influence each other. And it's a knock-on effect, the role of exercise in people's health. It's not the answer on its own. And I think the professor you had on did make that point, that certainly exercise is not the answer, but it's a step in the right direction.
Lavina, what would you add?
Yeah, I totally agree. I mean, obviously, we're both passionate. This is why we're doing what we love, and we're just trying to give people advice on. No,
I know. I'm not saying it from that perspective, but we all have an interest here, don't we? And isn't it important to actually just focus as much about the diet and what we can do to help ourselves, but also look at what others can be doing to protect us?
Yes, definitely. I think this report needs to be taken very seriously by the government. I think those, that have that influence are going to have to look at agents, how they're protecting us. Are we all going to, those that aren't in frontline roles, are people going to be a lot more worried and have to work from home? Are we getting the PPE? We need to start raising our voice, which is exactly what you're doing here, but it needs to be on a big scale, and they really need to take notice, because not just, Asians, I think a third of the cases a few weeks ago reported of COVID were for Asian people. Now, obviously, the link with diabetes, and we all have someone that we know with diabetes. I mean, I have it in my family as well. But it then links on to so many different aspects that we definitely need protection, we need awareness, and we need them to listen.
Lavina, Ravi, appreciate both your time here. 11:10 here on The Big Debate. Going to go to Navida in a